PN 12. Q. The nurse is providing dietary teaching regarding low-sodium diets for a client with hypertension. Which food should be avoided by the client on a low-sodium diet? A. Dried beans. B. Swiss cheese. C. Peanut butter. D. American cheese. Rationale: the client should avoid eating American and processed cheeses such as Colby and cheddar because they are high in sodium. Dried beans, peanut butter, and Swiss cheese are low in sodium, therefore, answers A, B, and C are incorrect. Q. The nurse is reading an admission history for a client recovering from a stroke. Medication history reveals the drug clopidogrel, Plavix. Which clinical manifestation alerts the nurse to an adverse effect of this drug? A. Epistaxis. B. Abdominal distension. C. Nausea. D. Hyperactivity. Rationale: Plavix is an antiplatelet. Bleeding could indicate a severe effect. Answers B, C, and D are not associated with Plavix. Q. Fetal heart tones can be heard using a fetoscope as early as A. 5 weeks gestation. B. 10 weeks gestation. C. 15 weeks gestation. D. 18 weeks gestation. Rationale: fetal heart tones can be heard using a fetoscope as early as 18 weeks gestation. Answers A, B, and C are incorrect because fetal heart tones cannot be heard using a fetoscope before 18 weeks gestation. Q. A child with cystic fibrosis is being treated with inhalation therapy with pulmozyme, Dornase alpha. A side effect of the medication is A. weight gain. B. hair loss. C. sore throat. D. brittle nails. Rationale: side effects of pulmozyme include sore throat, hoarseness, and laryngitis. Answers A, B, and D are not associated with the use of pulmozyme. Therefore, they are incorrect. Q. A client with cystic fibrosis is taking pancreatic enzymes. The nurse should administer this medication A. once per day in the morning. B. 3 times per day with meals. C. once per day at bedtime. D. 4 times per day. Rationale: pancreatic enzymes should be given with meals for optimal effects. These enzymes assist the body to digest needed nutrients. Answers A, C, and D are incorrect. Methods of administering pancreatic enzymes. 138 Chapter 2. Q. A 9-month-old is admitted with a diagnosis of eczema. The nurse would expect the 9-month-old to have eczematous lesions over A. the abdomen, cheeks, and scalp. B. the buttocks, abdomen, and back. C. the back and flexor surfaces of the arms and legs. D. the cheeks and extensor surfaces of arms and legs. Rationale: eczematous lesions are more common on the cheeks and extensor surfaces of the arms and legs. Answer A is incorrect because the abdomen is not a common site of eczematous lesions. Answer B is incorrect because the buttocks, abdomen, and back are not common sites of eczematous lesions. Answer C is incorrect because the back and flexor surfaces of the arms and legs are not common sites of eczematous lesions. Q. Which of the following nursing interventions has the highest priority for the client scheduled for an intravenous pyelogram? A. providing the client with a favorite meal for dinner. B. asking if the client has allergies to shellfish. C. encouraging fluids the evening before the test. D. telling the client what to expect during the test. Rationale: the contrast media used during an intravenous pyelogram contains iodine, which can result in an anaphylactic reaction. Answers A, B, and D do not relate specifically to the test. Therefore, they are incorrect. Q. The client arrives in the emergency room with a high FEMA. Which action by the nurse would be best? A. elevate the head of the bed and apply ice to the eye. B. place the client in a supine position and apply heat to the knee. C. insert a Foley catheter and measure the intake and output. D. perform a vaginal exam and check for a discharge. Rationale: high FEMA is blood in the anterior chamber of the eye and around the eye. The client should have the head of the bed elevated and ice applied. Answers B, C, and D are incorrect and do not treat the problem. Q. The nurse is assessing elderly clients at a nursing home. Which of the following findings would not be considered a normal part of the aging process? A. Complaints of a dry mouth. B. Stiffened joints. C. Ralls bilaterally on chest auscultation. D. Loss of 1 inch of height in the last year. Rationale: Ralls would indicate lung congestion and the need for follow-up. Answers A, B, and C are normal health-related changes with aging. Q. A pregnant client with a history of alcohol addiction is scheduled for a non-stress test. The non-stress test: A. Determines the lung maturity of the fetus. B. Measures the activity of the fetus. C. Shows the effect of contractions on the fetal heart rate. D. Measures the neurological well-being of the fetus. Rationale: A non-stress test is done to evaluate periodic movements of the fetus. It is not done to evaluate lung maturity. Answer A is incorrect because a non-stress test does not measure lung maturity. An oxytocin challenge test shows the effect of contractions on fetal heart rate. This makes answer C incorrect. A non-stress test does not measure the neurological well-being of the fetus, so answer D is incorrect.